Dr. Matthew, if I can present the same to you. So your organization, you guys are on the forefront. Many people model after Cook County in many different ways. What are you seeing as the problem, and what can the common man or common woman do about patient access? And I'm not just focusing on insurance, but where do we go when we have a problem? You write to your congressman or you send an email to the CEO, nobody responds. Wherever it is in the world. What do we do? What does the patient do? How can we take charge? We want to be in the fight.
I think it is enormously complicated, and it is in fact that the reality is many of us in this room who hold medical degrees would also find it complicated to deal with our own insurance and our own health care at times. So you can only imagine how much more complicated it would be for our patients, particularly for patients like the ones I serve who are in fact underserved and have a number of socioeconomic disadvantages and complexities that make access even more challenging. So, one key strategy would be, easier said than done, but is in fact simplifying the process. And I think that's why there are folks who believe that a single payer model would be better than the complexity that exists now, but that's a bit off topic. With regard to access is so many things. Having insurance is one component of access. Having the ability to reach a care provider, whether it's an APP, primary care, or having the remote access even to subspecialty care, that's one element of access. For someone who takes care of an urban population where there is a density of physicians in certain areas of the urban community, still access is a problem for my patients as well. So you have to be able to get in through the door. It's not as simple as having a physician down the street. So it's one of my colleagues also already said it's very much multifactorial. At Cook County Health, we are not just a provider of health care, we are also a payer of health care because we do have a Medicaid basic expansion, HMO, which is called county care. That provides us unique challenges, but a great deal of opportunity as both the provider and the payer to work not only in acute care settings, but really look at population health and managing patients and actually intervening on some of the socioeconomic determinants of health, specifically housing access, food availability, and fresh food and healthy food access, transportation. We're able to partner around housing with our food partners. We provide transportation to our county care as well as our uninsured patient population, which is a very significant number at Cook County Health. So we're able to provide those wraparound services. We are a county hospital and we are resource limited, but we do have a density of physician providers, so we have some advantages that our rural colleagues may not have. So
thank you.
Very mindful of the unique challenges of rural care.
Sure, and like Dr. Reeves said, and you have reiterated, it is multifactorial, and you're very right. There are so many socioeconomic determinants, layers of healthcare. It's not just pop a pill and I'm better. There are a lot of moving components, no doubt about that.